Yes. Now we'll discuss about the ulna. Its shaft and lower end. Part 1 of the ulna. First of all, we'll make a diagram. This is anterior view of the ulna. This is anterior view of the ulna, and here is posterior view of the ulna. This is posterior view of the ulna. This is anterior view, this is posterior view. Here is position of radius. This is position anterior view of the radius. This is posterior view of the radius. Now we'll discuss about the lower end and shaft of the ulna. This is ulna. It has lower end. This part is shaft. This is upper end. First of all, we'll discuss about the lower end. This is lower end. It has a process here. Posterior-medially, this process is styloid process. And here is articular surface. This articular surface is head of the ulna. This is head of the ulna. This articulates with the ulnar notch of radius. In the radius, this is ulnar notch. So it articulates to this and form the inferior radio-ulnar joint. Here inferior radio-ulnar joint is formed. So in the lower end there is a styloid process and head of the ulna, and here you can see posteriorly there is a groove. Here is a groove. This groove is for the extensor carpi ulnaris. Here tendon of the extensor carpi ulnaris process. This is posterior view. So styloid process, here is styloid process. This is head, this is head. Now we'll discuss about the shaft of the ulna. This is right hand side of the ulna. If you cut a section at this level, you will find it is like this. This border is lactal border. This is lactal border. It is also known as interosseous border. This is interosseous border, and here is anterior border. This border is anterior border. This is posterior border. So there are three borders. Lateral border, which is interosseous border. This is lateral border. This is anterior border. This is anterior border here. And this is posterior border. This is posterior border. This is posterior border. And surfaces. This is anterior surface between interosseous and anterior border. So this is anterior surface. On medial side, this is medial surface. So this is anterior. This is medial. And this is posterior surface. This surface is posterior surface. Anterior surface has a foramen. This foramen is known as nutrient foramen. Foramen. Direction of the foramen is upward. And here one artery passes, that is a branch of anterior interosseous artery. So here anterior interosseous artery branch, that is nutrient branch, passes through this towards the upper side. So direction is upward. So this is all about the part first, shaft and lower end. Thank you. Yes. Now we'll discuss about the upper end of the ulna. Here you can see this is upper end. This is upper end. This is upper end. Upper end has two processes and two articular surfaces. So it has two processes and two articular surfaces, or two notch. So this is one articular, one process. This process is olecranon process. This process is olecranon process. So this is olecranon process, and another process, this process is coronoid process. And two articular surface. In this process there is one articular surface here. This is trochlear notch. Trochlear notch. And here is another articular surface. This articular surface is, this is a radial notch. So it has two articular surfaces. These are the trochlear notch and radial notch. If you see from the lateral side, you will find it will be like this. This is articular surface. Here, from this point to this part, this is olecranon. This is olecranon process, and this part is, this is coronoid process. This olecranon process has 5 surfaces. This process has 5 surfaces, and this process, coronoid process, has 4 surfaces. 5 surfaces are, here is superior surface from here to here. This is posterior surface. And this surface here, this surface on lateral side, this surface, this part, this is lateral surface. So this is lateral surface, this is superior surface, this is posterior surface. And anteriorly, this is anterior surface, and this anterior surface is articular. It forms the trochlear notch. So anterior surface forms the trochlear notch. So this is anterior surface forms the trochlear notch. And medially there is medial surface. So it has 5 surfaces, and this part from here to here, this is coronoid process. This process is coronoid process here. So this part is coronoid process. it has superior surface. This surface, this is articular. This surface forms the part of trochlear notch. This is form the part of the trochlear notch, lower part of the trochlear notch. And upper part is formed by anterior surface of the olecranon process, and lower part is formed by superior surface of coronoid process. Here is inferior surface of the coronoid process. This inferior surface of the coronoid process form a tuberosity known as ulnar tuberosity. This is ulnar tuberosity. This is ulnar tuberosity. It has medial surface and it has lateral surface on lateral side. Here lateral surface. Here you can see lateral surface has a radial notch here. So lateral surface has a notch. This is radial notch. It has anterior margin. This is posterior margin. This is notch. This is radial notch. Here, this radial notch accommodates or articulate with the head of the radius, and its margin gives attachment to the annular ligament. Its margin gives attachment to the annular ligament. Here is annular ligament. Here is annular. This is anterior margin. This is anterior margin. This is posterior margin. This is posterior margin. It gives attachment to annular ligament. This ligament is annular ligament. So it has four surfaces: superior surface, inferior surface. Superior surface is articular, form the radial, trochlear notch. Lateral surface articular, form the radial notch, and inferior surface form the ulnar tuberosity. And then another surface, like medial side, this is medial surface. So this is all about the upper end of the ulna. Thank you. Now we'll discuss about the side determination of the ulna. Before starting discussion about the side determination, one thing is left in second part, that is a part, this is supinator crest present on the lateral surface of, here is supinator crest present on the lateral surface of the coronoid process. This is coronoid process. Here is lateral surface of the coronoid process. Here this is crest like structure. This is supinator crest. Now side determination. The ulna, side of the ulna can be determined by keeping three things in mind. One thing, its upper end has two processes, that is olecranon process and coronoid process, and the lower end is having head and styloid process. Direction of the styloid process is posterior-medially. It lies posterior-medially. And another thing, this is lateral border. This is lateral border. It is sharpest border, and it is also known as interosseous border. So one thing, here is olecranon process directed upward, and styloid process directed downward, and it lies posterior-medially. This sharpest border lies on the lateral side, that is interosseous border. And another important thing, that is here trochlear notch. This trochlear notch facing anterior side. So this is all about the side determination. Thank you. Yes. Now we'll discuss about the muscles takes origin from the ulna. Here is one muscle. Here is supinator crest. This is superior intercrest and anterior triangular area to the superior intercrest. Here muscle arise, that is supinator muscle. Supinator. Another muscle which arises from the medial part of coronoid process. From here, this is flexor digitorum superficialis. Flexor digitorum superficialis. And here, this is pronator teres. Another muscle, this is pronator quadratus. Sorry, this is flexor. This is flexor digitorum profundus. Flexor digitorum profundus. Here is pronator quadratus. This is pronator quadratus. Another muscle, this is medial surface. This is medial surface. This is posterior view of the ulna. Here flexor digitorum profundus. This is flexor digitorum profundus. Arises from this area. And another thing, this is posterior border, and this posterior border here. It gives attachment to the aponeurosis. Here one aponeurosis is attached. And this aponeurosis gives attachment, gives origin to three muscles. One is this muscle. This is flexor digitorum profundus. Some fibers of the flexor digitorum profundus arise from this aponeurosis, which is attached on the posterior border. Another muscle which arises from this aponeurosis. These muscles are flexor carpi ulnaris and extensor carpi ulnaris. So there are three muscles which arise from this aponeurosis. These are flexor digitorum profundus, flexor carpi ulnaris, extensor carpi ulnaris. Another muscle which arises from this part, this is abductor pollicis longus. This is abductor pollicis longus. Here is extensor pollicis brevis. Extensor pollicis brevis. And there is extensor indicis. Extensor indicis. So abductor pollicis longus, extensor pollicis brevis, and extensor indicis. So here you can see the number of the muscle takes origin from the ulna. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10 muscles takes origin from the ulna. Thank you. Now I will discuss about the insertion of the muscle on the ulna. Here, this is Styloid process. Here one muscle is inserted. This muscle is triceps. This muscle is triceps brachii. This is triceps brachii. Another muscle is attached here. inserted here, that is, this muscle is enconeus. This muscle is enconeus. This is enconeus. Another muscle is attached on the Styloid process and ulnar tuberosity here. This muscle is brachialis. This is brachialis. So brachialis, enconeus and triceps brachii. These are three muscles which attached on the ulna. So there is insertion of three muscles. And another thing, attachment of the ligaments or membrane. Here is one membrane attached. This is interosseous membrane which attached with the interosseous border. This is interosseous border of the ulna. Here is interosseous border of the radius. Between these two borders there is membrane. This is known as interosseous membrane. This membrane is interosseous membrane. Another thing, here is, this is oblique cord. This is oblique cord. This is oblique cord. Here is, this is quadrate ligament. This is quadrate ligament here above the radial tuberosity, and below the radial tuberosity is oblique cord, and below this is interosseous membrane. Here is annular ligament attached with the margin of the radial notch. This is annular ligament. So this is annular ligament. Here is articular disc. This is articular disc. And here some fibers of the styloid process, the ulnar collateral. This is ulnar collateral ligament of the inferior radial joint. So here ulnar collateral ligament is attached here. And another thing is capsule of the joint. So this is margin of the attachment of the capsule of the joint, that is capsular ligament. And here you can see on the posterior border there is aponeurosis. This aponeurosis gives attachment to three muscles we have seen in previous lecture. So aponeurosis. So here you can see 8 membranous structures, aponeurosis, or ligaments attached to this ulna. One is quadrate, another 1, 2, 3, 4, 5, 6, 7, and 8. So these are 8 membranes or ligaments or cords attached to this ulna. So these are the attachments of the ulna. Thank you. Ulna ossify from one primary center, one primary, and two secondary center. One primary center appears in the shaft during 8th week of intrauterine life. This is 8th week of intrauterine life. and for the upper end, for this upper end, it ossifies in secondary centers. Here it appears, secondary center appears during 10th year of the life, and it fuse with the shaft during 16th year, or it ossifies in the 16th year. Here, this is lower end. For the lower end, secondary centers appears during 5th year of the life, and it fuse with the shaft, or it ossifies during 18 years of the life. So this is all about the ossifications of the ulna. Now applied aspect of the ulna. This ulna may fracture single or with the radius. If both bones are fractured like this, then sometimes there may be chance of cross union. This upper part or upper fragment of this ulna articulates with this distal fragment of the radius, or this upper part of or proximal part of the radius articulate with the distal part of the ulna. So this is cross union. Due to this cross union, patient cannot perform pronation and supination movement. So this is applied aspect of the ulna.